definitely my predictions that a second epidemic, not to say pandemic, is on the way, and this time it will be mental health pandemic.
People are starting to experience a level of trauma that is very familiar to many who have served in the military. Having to face an invisible enemy, having to be hypervigilant all the time.
It's kind of like running a marathon, except you don't know how long the marathon is.
I haven't really thought about the long-term effects of it just because I'm just trying to get through the here and the now.
Do you feel like any of the preparation that you were really given during residency prepared you for what you were going to end up going through?
Absolutely not.
As COVID-19 continues to spread throughout the United States, some frontline medical workers have described conditions in their hospitals as apocalyptic.
We do this all day, every day for the last month.
And as the nation navigates its way through this pandemic while watching its devastation on the evening news, the weight of that devastation is heaviest on our frontline workers, causing some mental health experts to believe that we are on the brink of a mental health crisis in the wake of what could be the worst pandemic in American history. On this episode of The Latest, we explore the mental health toll of the coronavirus pandemic.
I do believe very much in resilience when humans really facing extreme adversities. However, I think that the mental stress of this outbreak is something that we have not seen before. And this is something that we, frankly, are not prepared to deal with. My name is Yuval Neria, and I am director of the PTSD program at the New York State Psychiatric Institute.
So what outcomes do you expect to see among our essential workers?
We will see PTSD. We may see high levels of anxiety that are not really diminished over time. But what you see lately, now after 2 months or so, you see more of a depressive symptoms, which are really worrisome. People are tired, there is fatigue. We're already hearing about suicide attempts and successful suicide attempts, including in the medical community.
On Sunday, April 20th, Dr. Lorna Breen, an emergency room doctor at New York Presbyterian Hospital, committed suicide.
She even contracted COVID herself. As soon as she was better, she went back to work.
And the extensive media coverage of this tragic event reminded us all of the mental health challenges that our frontline medical workers are facing.
I'm crying at work. You come home, I'm crying in the shower. I wake up, I got to go back to work. I'm crying, pouring my coffee. So it's like just kind of these, emotions and just kind of laying around, not wanting to do anything. It just makes you think like, am I getting depressed? Is that what these are, signs of? My name is Daisy Filzer. I am a nurse in the medical ICU unit in a hospital here in the Chicagoland area. We started transitioning into becoming like a COVID unit, I would say middle of March. And everything has been kind of hectic since then. Who knows when we're going to even go back to our regular medical ICU and just kind of see a little bit of everything.
I know people think of, hospitals as places where people are very sick, but people don't actually die that often. It would honestly maybe be 3 or 4 a week. And that went up to like 20 to 30 per day, which is just an insane number of deaths.
The amount of COVID patients that have come in has definitely decreased, but when it was at its height, people would come in continuously through the day, on and on and on, and it was nonstop. It was a daily nightmare. Those first few days when things were absolutely chaotic, I would come home and I literally didn't know how to transition. It was like war.
We're starting to see those on the front lines of healthcare having some predictable, to me, mental health outcomes. I'm Dr. Shauna Springer. I'm known within the military and veteran community as Doc Springer.
Can you explain briefly what PTSD is and how your previous work and your expertise in PTSD has shaped the way that you're viewing what we're all kind of living through right now?
PTSD is a prolonged shift in your assumptions based on being exposed to something that leaves you with a feeling of helplessness or horror and changes how your biology functions and, basically how you operate in relationships. And many of our ER docs and nurses are wired like some of our combat warfighters, in the sense that they can stay calm in a chaotic situation because of their level of training, their skill. And if you send them into a situation that increases their sense of helplessness and maintains that sense of helplessness, it will have the kind of mental anguish effect that we are seeing among those in the front lines.
Yes, death is a part of our job. However, after so many patients dying and after so many, days in a row, it's kind of like it takes a toll on you. And I was remembering one shift, I was just super busy, constantly on my feet. And it just kind of hit me and I just became overwhelmed and I just started to cry at work. And my coworkers are like, what happened? What's going on? I'm like, nothing happened. It's just, you don't really have time to think for yourself and kind of just debrief after everything that's going on.
I remember I would take the subway home. I'd walk in my door. I'd see my couch and I would just start bawling because I didn't know how to process it. And then I would sit here and just stare at the floor. And those were the days when I would FaceTime my friends and they would ask me how I'm doing, that I would just start crying because you don't think about it in the moment. You don't think about the fact that you just saw this old woman who has had a beautiful, vibrant life, lots of children, lots of grandchildren who just died in front of you and you didn't have time to call their family. And there's no one there to call the family. So the days home were the hardest part, I would say, actually.
We all think of like parents supporting their kids, but it's only during this pandemic that I realized how much they were supporting me. And that's the kind of thing that is really hard, not being able to see your kids. I mean, I didn't even realize how much of like an emotional support they were to me and how like not seeing them, has been really hard. And like taking that emotional support away has been really hard. And I just can't wait for that to come back. So
we're also socialized to treat people as though they're heroes when they're on the front lines and put this invisible pressure on them to be strong for us. We stand back and we applaud them and we say, look at how resilient those people are. And what we don't understand is, just like with our warfighters, that is a way of telling people, I need you to be two-dimensional. You can't be fully human. You have to do what I can't do. And you get my applause and I'll thank you for your service, but I'm not going to show my support in the ways that cost me something.
Whenever people are calling me like, oh, you're a real hero, it makes me feel uncomfortable. I don't know why. One, maybe because I'm not one to really accept compliments. It's one thing to tell me that I really appreciate what you're doing, but I feel like I did not sign up to be working in these conditions where we have a lack of PPE. Heroes don't work in these conditions where they aren't optimal to do their job.
There's a real problem in medicine with kind of the macho culture. It's not so much a macho culture because there's more women in medicine now than men, but there's still a culture of don't take care of yourself, take care of your patient. And so I think a lot of people are pushing things down. And, honestly, all of the language about how we're heroes and applause for us, it kind of just contributes to that in some way. I mean, it's great, it's beautiful, but the imagery of heroism lends itself to like just, going and taking care of the patients and not thinking about yourself.
We wake up, we go to work, we save lives. That's just what we do. And I'm honored by the hero title. I have, texts from a bunch of people from my past who have creeped up during this time who are like, thank you so much for your service. I'm thinking of you. And those things just, bring me to tears with joy. It's like the most insane feeling in the world. And the 7:00 claps, I mean, it gives me chills every single day to hear this. When I'm going into night shift, I literally walk through it and I hear people clapping for me to go to work, which is insane. Like celebrities hear that, like basketball, like athletes, that, and it feels really great. But I don't necessarily feel like a hero any more than any other day.
And so what outcomes do you expect to see among our essential workers, not just those medical doctors who are really bearing the brunt of a lot of this work, but even, our garbage men, the people who are driving our buses, all of those folks?
Yes, absolutely, Lee. I mean, I agree with you. I think that it's a mistake to focus only on the medical teams. There is so many workers and public officers that are really giving everything that they have in order to serve us. So we definitely going to see grief reactions or complicated grief reactions among people who lost loved one in a very bizarre way. The fact that people are not able to come to say goodbye to their loved ones in the ICUs before they pass.
A lot of the time say it'll be a grandfather, they have the grandchildren on the Zoom call and like 20 other people on the Zoom call, saying goodbye. And you have these grandchildren like telling, grandpa, wake up. So it's like,
oh God.
Yeah, it's something that's definitely really hard. And you start to realize like the kind of person that they were prior to being here. And, it just kind of gives you a whole new perspective on the patient.
We've heard about burnout rates among doctors, right? And it's something that actually goes really underreported.
I've heard colleagues, I'm not going to name any names, obviously, but I've heard colleagues say, I got to get out. This is too much. And that's a shame. And it's actually really dangerous because if that happens enough and it happens soon, more patients are going to die. So I really think we have to find ways to take care of the healthcare workers because this is not a time for us to be losing doctors and nurses.
Right. Is it realistic to think that we as a country are prepared to deal with the fallout of this pandemic from a mental health perspective?
I don't think we can do that without help of the federal government, really. Ones that will really synchronize efforts. There is no VA, Veterans Administration, department to address this pandemic. And I would say millions of people in this country will need a trained clinician, experts in trauma, stress, grief, substance abuse to address their mental health needs. That's
millions of people.
I'm speaking about millions of new clients. This is how you have to start thinking about that and plan for that.
Looking back on it, of course, we're going to be traumatized from this. Of course, we are going to have lasting impacts from it. I still see patients who are incredibly sick from COVID, and the pit in my stomach pops up because I know that something really bad can happen at any moment, and I need to reach out to the family, and I need to do this and all the new things I've learned. And am I going to get it from being around them? Am I going to give it to my family members? Is something worse going to happen? And I think about the sick patients at night, and that is a symptom of PTSD. I wonder if it will continue for a long time. I mean, we don't even know when this is going to end.
I think just because I'm so focused on what's going on right now and how I'm feeling right now, I haven't really thought about long-term effects. I'm worried about, coming in contact with my dad, with my aunts, my uncles, who are older, and I just think that people need to take this a lot more seriously.
We all struggle with being alone, like we're quarantined. It's hard for everybody, but it's extra double hard when you're a doctor working in a COVID hospital. Like, guess who does, like, nobody wants to take a walk with me. Nobody wants to be 6 feet apart in the park. Nobody wants to do that with doctors and nurses, right? And so be there for the doctors and nurses in your life, whatever they need, give it to them because, it is hard. And just little things matter. So, check in with your doctor and nurse friends. That's all.